Good morning, and thank you and welcome everyone. I'm Deborah Dunlap-Avasti, Chairwoman of the Board of Directors for Central Maine Healthcare, and I'm very pleased to be here with you today. This is an exciting milestone for Central Maine Healthcare, and I'm glad you're all able to join us on this beautiful spring day to help spread the word of this wonderful new facility. I grew up in Auburn, and I work and live in the Brunswick area. And I've seen a lot of change over the years in our communities, both here and across the state. Healthcare is no exception. I think we can all agree that regardless of where in Maine you live, the state of healthcare has become increasingly complex and challenging for everyone, every person, community, and provider. Central Maine Healthcare recognizes these challenges and is dedicated to ensure top quality services and solutions at affordable costs for our patients, employers, and insurance payers. Like many hospitals, reimbursement rates can fall short of meeting increased costs for technology and facility infrastructure and supporting our staff with competitive wages and benefits. But tough challenges call for bold solutions. And since his arrival, Jeff Brickman, our president and CEO, has helped transform the way we do business. Utilizing his experience in other markets faced with similar challenges, Jeff and his team took a hard look and a fresh approach to meeting the healthcare needs of those we serve. What we're here to celebrate today represents more than a year of hard work for many people. But most importantly, it represents the launch of a new era. A new way to provide care, a new way to access care, a new way to experience care. Central Maine Healthcare has a long history of enhancing the lives of our patients and elevating our communities. We are dedicated and committed to high quality care and accessible medical services in this community and region. Realizing our vision to change the delivery of healthcare in the state of Maine will help to ensure that that history continues well into the future. So without further ado, I'd like to introduce Jeff Brickman, President and CEO of Central Maine Healthcare.
Thank you, ma'am. Thank you, Deb. This is the third day of spring. Can you feel it in the air? Absolutely. Well, it's exciting to be here. I'd like to recognize a number of people who have joined us this morning. In addition to Deb as our chair of our health system, I'd like to recognize Mark Adams, our vice chair of our health system, Jolene Ippolito, a member of executive committee of our board, a number of our partners today, Steve D'Amato, who's representing Shields Healthcare as executive director, Carmel Shields, who's here representing our Shields Healthcare Group, New England Cancer Specialist, Steve, Tony James, who is our Senior Vice President for Integrative Services at Mass General Hospital. I'd also like to recognize our partner in a lot of this work, Bateman Limited, who is helping us bring this project to Topsham. As Deb indicated, healthcare is going through a tremendous transition, a tremendous transformation, and Central Maine Healthcare is right in the middle of it. I think we can read the newspapers every day and we can see the high cost of healthcare and the impact on many of our residents, many of our employees, many of our local businesses. All of us know a story about a medical nightmare. We're not talking about the clinical aspects of healthcare, but we're talking about the economic aspects of healthcare, where people have been saddled with healthcare costs that have created a tremendous burden to many individuals and family members. Central Maine Healthcare, understanding that, has been spurred to provide a creative solution for the state of Maine, drawing on experiences from across the country where other markets have responded to this type of concern in very innovative ways. Our healthcare leadership team has taken those national models, those best in practices approaches, and has assembled a very, very strong best in breed partners, from New England Cancer Specialists to Shields Healthcare to Mass General Hospital. We have really put together the best in breed to provide a very affordable, accessible, high-quality level of care. There was a recent article in the Wall Street Journal, February 25th, and it said that the days of the traditional hospital are numbered. If we think about it, hospitals within this country had their moment in 1986, 32 years ago. That's when the majority of health care was provided within a hospital setting. Since that time, 32 years later, technology and approaches to health care have increasingly moved to an outpatient setting, where 85 to 90% of care can now be delivered outside of a hospital's four walls. Yet within this state, we have not adapted to those trends. What we are trying to do and are introducing in this project today is our approach to provide a more contemporary approach to healthcare at affordable, high-quality care. This level of service is unencumbered by the hospital costs in which we stand ready 24 hours a day, 7 days a week, 365 days in which we carry those costs to provide those services, can provide a different level of affordability without that costly overhead. And as we unencumber ourselves and provide outpatient services in an area in which we bring our care to where people work, live, play, and pray, to improve accessibility, we think that we can do a better job. Our partners that we've brought together have experience in this space. They are sharp, they are nimble, they are very consumer-oriented. You normally don't hear those words associated with a healthcare system, right? And so what we're doing by introducing this model of care within the state is to really change our approach, to change our level of service, to change our culture. And if we do this well, we can provide a better experience for our communities, we can bend the cost of healthcare, we can provide greater quality of life for our businesses, for our communities. We can be an economic driver within the communities that we serve, and at the end of the day, we can actually improve healthcare, which is what we're all about. To show you how old I am, I remember doing house calls with my grandfather in the greater Boston market. And when I was 5 years old, I used to grab his black bag and go with him to people's homes and watch him, unencumbered by all the specialty care that has absorbed health care, and watch him provide great personal care. 38 years into my career, I continue to draw inspiration from those early days and from my grandfather's approach to healthcare. And so when I think about going back to basics and getting out into communities such as Topsham, I think about my grandfather. And I think about the impact that we can provide as a health system to really improve how we provide care within the state of Maine. And that's what Central Maine Healthcare stands for. To give you a little vision of the future, Central Maine Healthcare is our name. It doesn't define our aspirations. I like to say Central Maine Healthcare doesn't define where we're going, north, east, west, and south. We have great aspirations for the state of Maine. We're excited to be able to introduce this new model of care today. We're excited to have you come in and actually view this project as we unfold it to the communities that we look to continue to serve as we have this last decade in Topsham. We're responding to their request to double down our investment in Topsham and continue to provide a high level of care. To assist me a little further in the vision of health care, I'm going to draw on one of our partners, our Executive Director for New England Cancer Specialists, a great partner, Steve D'Amato. Steve, if you join me.
Thank you very much, Jeff, and I have to say that it's been a great experience working with Jeff and his team, and thank you all for coming here this morning for what is truly going to be an exciting event and really a facility that's really going to serve our patients in the future. We're really thrilled to be here today with our partners from Central Maine Healthcare, Shields, and Massachusetts General Hospital. The mission of the Topsham Care Center is well aligned with what we do at New England Cancer Specialists, and we assure that this facility will improve access and coordination of care for patients in the Topsham community and beyond. New England Cancer Specialists is built on a community oncology model. We offer outpatient treatment for those with cancer and blood disorders in a team-based environment that puts patients first. We believe in research and innovation, and we participate in more clinical trials than anyone in Maine. NECS was founded more than 50 years ago as a small independent physician practice. We have since grown our team to over 14 physicians and 14 advanced practice providers and more than 180 employees dedicated to one goal: each patient's best outcome. We are Maine's only certified oncology medical home, providing wraparound services for patients as they go through their cancer journey. We work tirelessly to advocate for the best care at the lowest cost to our patients. We have been recognized for our quality at the national level, and we never stop looking for ways to improve. We are excited to provide high-quality care to the Topsham Care Center and to be able to offer our patients access to the additional services and expertise our partners bring under the same roof. Our teams look forward to continuing to serve the communities of the Mid-Coast with leading-edge treatments. Our office here will include 16 treatment chairs for infusion, a reflection garden adjacent to the treatment room for patients and families, lab and pharmacy services. 3 physicians, Dr. David Benton, Dr. Eleni Nakos, and Dr. Brian Haney, will lead our care teams, providing the same warmth and personalized care we have offered to each patient since 1967. So again, thank you. Thank you to our partners. A really exciting time for us. And with that, I'd like to introduce Carmel Shields, Executive Vice President for Shields Healthcare Group.
Good morning. Thank you. As a team member of Shields Healthcare, it is our privilege to partner with Jeff Brickman, the leadership team, and the board of Central Maine Healthcare. It was just 16 months ago we partnered with Central Maine for PET CT services at Lewiston. And on January 1st of this year, we opened our first MRI center at Lewiston, and it's the first open-bore MRI unit in the region. And now we come together to celebrate the vision and strategy of Central Maine Health, New England Healthcare Specialists, and the personal support of the professional support and personal support, I'm sure, of Massachusetts General Hospital. We are honored and humbled to be a part of this terrific effort and to work with our most respected partners to bring exceptional care to our community and to our patients. Be assured we will work tirelessly every day to provide exceptional radiology services, the care that this community deserves in a first-class, vibrant, patient-centric, and engaging work environment. Thank you. And that's okay. And I'd like to introduce Tony James of Mass General Hospital. Thank you.
See if we can get this to go up a little bit. Hi, I'm Tony James from Mass General Hospital. I'm thrilled to be here today to open this exciting new facility. This is really a testimony to something we've seen. We've been working with Central Maine since 2009. And Jeff's vision about where he sees healthcare going across the state of Maine, something we find tremendously exciting. And so the ability to turn this around so quickly with this set of partners, which is really incredible, I think is going to be an incredible benefit for the people, not just here, but more broadly across Maine. As I said, we've been working together for a while in a number of clinical areas, cancer being one of them, also around cardiology, cardiac care, trauma services, and stroke care. And that's just sort of the tip of the iceberg of where we hope to go. And we think of this ability to bring the best of community care and the best of academic medical medicine together in one spot as tremendously important. It's something we're doing across the region. But I have to say, in many ways, Central Maine is out in front of most community hospitals that we see. The ability to think out of the box create different models for care is really quite invigorating. So we are absolutely thrilled this is opening. We're hoping that this will be replicated across other parts of the state and we can be helpful in those endeavors. But I think you all you haven't quite realized, you haven't seen what's going to happen yet, but I think it's going to be transformative in so many ways. So we're thrilled to be a part of it. We're incredibly excited that this level of care will be made so accessible to folks, and this is really where we see the future of healthcare going. So let me, at this point, turn over to John Shattuck, who's in charge of economic and community development for the city of Topsham.
Bring this back down to earth a little bit. Thank you, Tony. The bad news is I'm the last thing that stands between you and a tour of this great facility. Good news is I'll be uncharacteristically brief. My primary goal here is to thank Deb and Jeff and this great leadership team in this truly impressive gathering of excellence in your affiliates and partners in this project. This is, as Tony just said, transformative. We work hard in Topsham to be not only welcoming, but supportive of our existing and new businesses. And I hope that was part of your choice here, and we are deeply grateful for that choice. Transformative is a key word here, not just because of what you're bringing to the medical practice and offering to this state. Anytime you have a sentence that includes market focus and medicine in the same sentence, you've got my intention. Transformative, disruptive, and a key strategy for us as a town has been to bring alternative uses into what we can't take much credit for, the fact that the town was founded on what later turned out to be a great central interchange for the state. So the fact that you're bringing to what's been traditionally a retail center, a different kind of use that is still dependent on access, proximity, and ease for folks to get to your services is going to be transformative for us and for this retail center. We're deeply grateful. Thank you very much for choosing Topsham.
Okay, a lot was provided, a lot awaits. Thank all of you for coming today. I want to recognize Peter Hayes and I want to recognize Michelle Probert as well. They've been great. Sounding board, they represent the Healthcare Purchaser Alliance of Maine. Part of our strategy is to really provide that alternative approach to healthcare to meet the needs of the greater business community within the state. We look very much forward to working with them in partnership.